People who aren't doing your job, they say, well, it's not that bad yet. It's not that bad yet. What is it like right now?
Bad. It's as bad as I've ever seen anything before. I've been doing this for 20 years, and I've never seen it this bad. I've been doing critical care for that long, and these are patients that are the sickest I've ever seen. We're used to taking care of sick patients in the ICU, 1, 2, and then we have some easy ones. This is one after the other. We have 6 ICUs already open that is strictly for COVID patients, and they are all on mechanical ventilation. They're all intubated, sedated, being paralyzed, as sick as they could be. We're having sicker patients on the regular floors that we usually would have in the ICUs, but don't have room for them. So the reality is that every ICU we open, we have another ICU ready to go. Today, we opened our 6th ICU, but the one that I was working in today only had 8 or 9 patients to begin with. We filled it up to 21 patients and then opened the next ICU, all on the ventilator, all as sick as possible. And it's just getting so bad, and it's getting worse every day. Every day we're getting more and more patients. Every day we're hearing overhead to intubate, for anesthesia to come and intubate people. And we cringe every time we hear that overhead because we know another patient is going on the ventilator and coming to the ICU.
We have to line them up one after the other, bed by bed, trying to intubate anywhere we possibly can to save people's lives.
Some doctors and nurses on the front lines say their hospitals are facing an overwhelming flood of patients.
There's patients building up in all the corridors on oxygen. The oxygen tanks are running low. The rooms are short. The nursing staff is short. The doctors are falling ill too.
These emergency room doctors say shortages are at dangerous levels.
We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
One of the most critical shortages, ventilators.
Think of it as your lungs being filled with fluid, like you're drowning. And once you get to that point where you're drowning, you need a ventilator to stay alive, and we're running out of that equipment for people.
Racing to fill the breach, New York is now urgently building emergency field hospitals at the Javits Center, in Central Park, and elsewhere. And around the country, cities bracing for impact are rushing to build out their capacity in case they're hit by the same tsunami as New York.
So this is our field hospital.
In Fredericksburg, Virginia, about an hour south of Washington, Mary Washington Hospital has set up a field hospital in the parking garage, just a few feet outside its emergency room.
We're going to start out with 2 triage stations, but we'll be able to scale that up as we need.
ER Dr. Eric Tosh takes us through what looks like a MASH unit with portable x-ray machines, oxygen units, intravenous equipment. They saw what was happening in the hardest hit cities, Tosh says, and got this facility operational in a few days. There are now only a few coronavirus patients inside the main hospital, none in the field hospital. But Tosh is confident that will change.
We hear from colleagues in New York and New Orleans that they're seeing as many as 200% to 400% of their normal daily volume. So this is designed for about that sort of influx.
It's required some creative ingenuity. The hospital took old waiting area recliners and converted them into treatment chairs.
And then put old plant hangers that we're going to repurpose as IV bag holders.
And they've installed a rather sobering feature that Tosh hopes his ER team will never have to use in case patients get violent.
If the people need to get out, we'll be able to get out through the back of the tent here and into the main treatment area.
An escape hatch.
Yes.
Tosh says right now he's balancing being prepared with managing the fears and concerns of his staff over what may be coming.
I don't know that anybody alive has ever seen anything like this, but we've had lots of training at being flexible and creative and doing things in the way that maybe they weren't meant to or designed to be done.
One thing Dr. Tosh is now concerned about is a drop-off in patients seeking emergency treatment outside of coronavirus. He's seen much fewer patients come in here seeking treatment for heart attacks and strokes over the past few weeks. He says they're all fearful that they're going to get coronavirus. Brian Todd, CNN, Fredericksburg, Virginia.
It's changed how Harborview runs.
Nurses and doctors at Seattle's Harborview Medical Center suit up. To go to battle with coronavirus, they have to go through an exhaustive dressing regimen, hoods and tubes and masks and gowns, just to enter a patient's room.
We think the greatest risk actually for healthcare workers is when they remove things that they contaminate themselves.
They have a checklist and a spotter helping with every step. They also have to adapt to new realities and shortages.
So these are what are called PAPR hoods. So these are the hoods that hook up to these machines that filter air.
And that's the hose that hooks up to the back of the hood.
They do get cleaned inside and out so they can be reused. Because the way they were built was for one-time use, but that's not the way. If we did that, we would already be out of it.
Wow. They have completely revamped 2 intensive care units.
So this whole unit was meant to be for people with brain injuries and strokes and so forth, and so now we have to move all of them someplace else because we have to continue that care.
So all the people with brain injuries were moved, and this was turned into a COVID-19 ICU unit.
Correct.
All to try and help coronavirus patients live, isolate them from others, and keep the staff safe too. So I am not wearing the full personal protection equipment because in these rooms where the actual COVID-19 patients are, these are considered negative pressure rooms. That means that we are considered in a safe space, not wearing full personal protection. Patients are being cared for, but we don't need to wear the full apparatus unless you are a doctor or nurse who has to go into the room to care for the patient. Inside the rooms, patients are hooked up to a shocking number of tubes, using those precious ventilators, the only thing keeping them breathing.
So for the ICU patients, they get very sick and they stay sick very long. So needing to require the ventilator for weeks at a time. And that's really the big issue.
Across just their 4 hospitals, 60 coronavirus patients were hospitalized last week. Already this week, it's at least 100. For each one, a delicate dance to keep staff healthy and patients alive. It is just coming in here and seeing the work that's being done and seeing the patients being cared for. It's stressful. I'm scared for their families as well. And so as you walk through and you see the hard work being done and people doing everything they need to take care of patients, it's awe-inspiring, considering the fact that they too could be putting themselves in harm's way. Outside the hospital, a large tent has been erected to assess and test potential coronavirus patients. And this is happening before the anticipated surge here. I feel dread and I feel fear, and I'm not working on the front lines. What are you feeling as you're dealing with all these COVID-19 patients?
It's certainly a sense of anxiety because right now, we're kind of wondering what it's going to be like when that peak comes and when people are, flooding in. While the number of new infections in Washington seems to be slowing down, there's a growing sense they haven't seen the worst of it yet.
What they do every day is heroic. Going and taking care of patients without protection is not acceptable.